Hi, it's Jason Blake. I'm the Medicare Geek. I used to only give this to my agents, the new agents or agents who are struggling, but there's been so much poor service, so much misinformation, so much bad Medicare agenting out there the past few years through COVID, the stupid Joe Namath commercials and stuff. I really want to raise the bar for professionalism in this industry. I call this my Medicare appointment one sheet. If you'd like a PDF copy of it, feel free to email me. These are all the potential questions you want to ask to do a proper discovery so that you know that you're making the best product or products recommendations for the person in front of you. So I'll go through the questions, and some of them are self-evident. Some, if there's more thinking required, I'll let you know why. When you turn 65 or lose your work insurance, or hit 2 years since you got Social Security disability, which will make you eligible. So you want to determine when their Medicare Part B is in place. If they've been working and they work past 65, you may have to help them with a couple of forms. I'll do another video on that. How do you get Medicare post age 65? Do you live here year round or split your time here in some other place? That's going to make the difference, as far as networks with Advantage plans, especially. If they do spend time in other locations, you want to know where that is. Is it California, where networks can be a real issue? Is it someplace where they're going to fit in fine with a national network with like United or Humana? Things you need to know. I ask something like this: if you got a rare disease or something weird, would you want the option to go to a premier place like Mayo Clinic or Cleveland Clinic, or would you be comfortable getting the bulk of your care in this area? For me, I say on Kauai and Honolulu, including Queens and Straub and Kapiolani, which are some world-class facilities. That's going to be a dividing line too. And if they want access to those world-class facilities, you might want to start with a Medicare supplement, or you might want to make sure they have a strategy, another home or something where they could, or the state they'll be going to if they'll need some plan to get guaranteed issue in the future, or if they should just go with the supplement now. I say something like, I want to ask you some health-related questions. None of these are to underwrite you or disclose your personal information, just so I can point you in the right direction if I were the same person doing the same thing. Is that okay? I always get permission. Do you have any surgery scheduled in the next year? Are you getting cataract surgery or knee replacement? It can make a big difference. If someone's got 2 cataract surgeries coming up, that might mean the difference for year 1 and 2. Much smarter to do a SUP than like a Plan G instead of maybe an Advantage plan. Are you a multiple-time cancer survivor? You want to know, it can be costly anytime anybody gets cancer. But if there's somebody who's like, been through surgery, been through chemo, been through radiation, they're still checking every few months with PET scan. This might be the kind of person, might be more cost affordable and easier care to get them on a supplement. Do you end up getting a lot of physical therapy every year just as needed? Physical therapy copays in our area on Advantage plans, if they're not dual eligible, range on the low side of $25, on the high side $40 a visit. That's a lot of a copay if you're getting 20 PT visits a year. Again, you're balancing between Advantage supplement. Are you on dialysis or any infusion medications? Important. 20% copay adds up on those things. Do you know the difference between an HMO and a PPO? What I find here often, this year we don't have a lot of value differentiation between our HMOs and PPOs we have in years past. And small town people are very often fine with an HMO. They go to their family doctor first or anything, and they'd want a referral before anything else. Other people want that flexibility. They want to be able to manage their health care on their own. So you're just taking a temperature on where to steer this person. Can you tell me what regular medications you're on? If you see my perfect presentation video, one of the first things I do is start with going to Medicare.gov, putting in their meds, their zip code, their pharmacies, because oftentimes medication costs are the most expensive cost during the year if they're on, even one brand name medication. Who are your doctors? Obviously. Do you want to keep them? If a plan had better costs or benefits, would you be open to changing doctors, or do you want to keep your docs first and foremost? In our area, that's really not an option. Most of our primary care doctors are not taking new patients. So you'd never hear, I don't encourage agents to sell a plan based on changing doctors or networks until they've changed doctors and networks. I also do a financial screening. I also want to ask you some financial questions. I'm not trying to get into your business. I want to see if you qualify for any additional programs or government assistance. Is that okay? Always get permission. Then I'll screen them for both full Medicaid, for a Medicare savings program, and for extra help with prescription drugs. If you're an agent and you don't know what those are, you need to learn those. And then even here, our main hospital system has a financial aid program that goes up to 400% of the federal poverty level, which is a lot of people. If they do, I will help them apply for those things in the moment or set a time to do it. Is there anything specific that's important to you? I mean, we have our lens, insurance agent. We think these things are important. You want to hear what's on their mind, what's important to them. Sometimes it's gym membership. Sometimes it's eye doctor. Sometimes it's something out of left field. If they've got their mind on it, you want to be able to address whatever that is, even if it's not in your box. We talked about, I go to the Medicare Plan Finder. We talked about that. Unless there's sufficient evidence to think that they need a Medicare supplement, I will often then I'll do one of two things. I'll do the 2 ways to get Medicare and show them that and see which side they gravitate to, or I'll say, hey, part of my job is to be cheap on your behalf. What I've learned is most people over 65 or on fixed incomes, some of them in very dire situations in most of the country. So with a study out a few weeks ago that says you need basically a couple $100,000 more in savings to be on a supplement versus an Advantage plan, if they're not high income, I'm often going to roll out the benefits of an Advantage plan and the pros and cons as needed. And then you can always do a choice close. You can do 1 or 2 MAPDs. You can do that versus a supplement. Ultimately, you want to put it in their lap. And I've talked about this in my video. I do what's called the anti-close, and I'll do a different video on that later. But you want them to be self-selecting. My mentor always said, whatever our best advice is, it's their health insurance. We don't want them to be up at night worrying about their health insurance. So we can make our best recommendation, but at the end of the day, you want to give them what they want and they believe they need, even if that's 180 degrees different than what you recommend. If you have any questions, get in touch, Jason@themedicaregeek.com. Hope you're having a great day.